Hello, my name is Julio Hanson, and I'm a student here at Pepperdine University. I am also a singer-songwriter, actor, and I am an assistant principal during the day. I'm very pleased to present on this wonderful topic about the facets of Cuban healthcare.
Uh, my name is Felipe Martinez. I am a student from Pepperdine University, and I am a medical doctor with specialty in endocrinology. We try to do something more about leadership in the health. We can cover this topic about Cuba health.
Primeramente queremos dar gracias a todos los que están viendo en este momento y también a la Asociación de los Estudios de Cuba, Association for the Study of Cuban Economy Conference, y gracias por esta oportunidad de presentarles nuestros estudios.
Así que empezamos.
First, we'd like to give you some background and context of our study. Cuba basically has more than 11 million residents. The United States had an embargo in 1960 that really affected the country, extremely affected the country, and also something else that affected the country was the dissolution of the Soviet Union in 1990, which was considered a special period. One thing that Cuba is known for is their free medical school training and primary care for all. The Minister of Public Health and President of the World Health Assembly, Mr. Morales Ojeda, has shown that he is very willing to work with other countries and work with the Cubans in the country to show the good things that are happening in Cuba at this moment.
En el contexto de este estudio que hemos hecho, presentamos que Cuba cuenta con 11 millones de habitantes en la isla y que comienza con un gran problema, que es el embargo de Estados Unidos y todo este bloqueo económico, y cómo y de qué manera lo pudo superar para lograr un sistema de salud impresionante. Y aún más todavía cuando desaparece la ayuda de la Unión Soviética en el año de 1990, enfrentándose a un nuevo reto que había que superar. Sin embargo, con todos estos momentos de diferencias y turbulencias económicas que afectan sin duda el área de la salud, el sistema de salud cubano comienza a resurgir con un nuevo reto.
So to give you an overview, basically, of our studies, we talked a little bit about, or studied about Cuban healthcare, child growth and development, infectious disease, the mortality rate, mental health. We will talk about some conclusions that we came to and some recommendations and references. And all of these studies, we'd like to acknowledge all of our partners that were involved in this. Julie Sumner, Toby Baker, Hadi Rajabi, Jenny Chung, and of course myself, Julio Hanson, and Felipe Martinez.
Sin duda este es un trabajo que estamos elaborando como parte de tratar de integrar y aportar algo dentro de la salud cubana como Universidad de Pepperdine. Y este es el trabajo desarrollado por un equipo de 6 personas que ya mencionó el profesor Julio. Y los temas que vamos a ver va a ser básicamente el cuidado de la salud, el crecimiento y desarrollo infantil, las enfermedades infecciosas, la tasa de mortalidad, la salud mental y, claro, algunas conclusiones y unas posibles recomendaciones que podemos llevar a cabo.
So, Cuban healthcare, there are many pros of Cuban healthcare. First of all, the country claims that they're politically and economically stable. They have a low mortality rate in the country, high longevity, which means that a lot of the older elderly are taken care of as well, and they're living longer lives. Free healthcare it's free for everyone in the country, and free medical school, which is something that really helps their medical studies and helps the medical students be great doctors, and free medical schools open to everyone there in the country.
El sistema de salud cubano es un ejemplo admirable que ha sido elogiado por la Organización Mundial de la Salud y por otras organizaciones como la Organización Panamericana de la Salud en América Latina y ha sido vista con gran admiración incluso en Europa. ¿Cómo y de qué manera un país puede tener muchas cosas muy buenas a pesar de una crisis económica y problemas políticos que ajenos a la situación de la propia población, el gobierno hace los esfuerzos necesarios para llevar a cabo la salud?
And along with those pros, there are some cons. The Cubans, when we speak to a lot of the Cubans, some of them say that this Cuban healthcare that is supposedly free is only available and free to the elite. So that is something that we'll have to look further into. There's a scarcity of medical supplies. Right now, the supplies in Cuban hospitals are not as readily available as most would like. As well as the hospital equipment is in disrepair. And so that is a factor that is causing for some of the Cubans to say that there's lower levels of Cuban health care. There are private entities that are not allowed to conduct evaluations. So that means that a lot of the information that's coming out of Cuba is basically what the Cuban government is saying that they are doing and their successes. They don't allow anyone that is outside of the country to come in and evaluate their level of care. They don't spend as much money on their supplies. So it's kind of difficult to understand how their Cuban healthcare could be so high level if they don't spend a lot of their budget on on medical supplies. Doctors are often considered or pressured to perform. And there's a lack of transparency throughout all of this. When there's a lack of transparency, it's hard to really confirm all that is happening in Cuba right now. I'm sure that they're doing some great things, but because of this lack of transparency, it's difficult for us to really confirm the good things that are happening in Cuba.
Entonces, una de las cosas es que en nuestro estudio, en nuestra investigación que realizamos a cabo, nos percatamos de que pudiera haber tres tipos de salud en Cuba actualmente. Uno es considerado para la élite, ¿verdad? Para los del gobierno, para los que pertenecen al gobierno de Cuba. Otro que es para los extranjeros, que se les da atención porque vienen a dejar dinero. Y la tercera es para la comunidad normal, la gente normal de Cuba. Pareciera que esto ha sido un poquito desbalanceado debido a la urgente necesidad de captar dinero a como de lugar y poder tener lo más necesario. Sin duda, el nivel más importante que se tiene ahorita de atención es el nivel primario, de atención primaria principalmente a las mamás, a los niños y a los ancianos. Eso es valiosísimo, pero las otras partes están sufriendo, como son los hospitales de segundo y tercer nivel. Así que nos gustaría también revisar un poquito más la manera en que podamos evaluar para poder apoyar más el sistema de salud cubano, porque no tuvimos los suficientes niveles de penetración para encontrar algunas respuestas, ya que encontramos silencio en la población, tanto en el área médica como en el área de la propia población, cuando tratamos de preguntar ciertas cuestiones sobre Cuba, haciéndonos sentir que realmente es algo que no se puede hablar.
And so continuing with one of our topics of Cuban healthcare is child growth and development. Cuba developed 3 initiatives. One was to develop polyclinics, which would go into the community, people would have more access to health. Community collaboration, which would mean that people would be more involved in the Cuban healthcare. Scientific support and influence on policy. So these are 3 very important initiatives that Cuba put in place. The GDP was 5.3 per 1,000 live births in 2009. So that's an important figure. Infant mortality, 4.7 per 1,000 live births in 2015. The U.S. embargo and Soviet Union dissolution affected foreign trade. So this meant that a lot of the equipment and supplies they were receiving from certain countries were no longer coming to the country. A lot of the support from the Soviet Union at that time had stopped. So this hurt a lot of their Cuban healthcare. There was an effect on pharmaceutical products that were coming into the country as well.
Es bien importante destacar que el gobierno cubano ha hecho políticas de salud sumamente muy importantes y desarrolla 3 iniciativas para enfrentar la pobreza y cómo combatir los problemas de deficiencia de salud, y principalmente pone énfasis en la mujer, en el niño y en los ancianos. Y para lograr el efecto de éxito en cubrir la salud, él desarrolla estas 3 en una que se llama policlínicas, y la importante que es la colaboración comunitaria como país socialista, y la tercera, apoyar a la comunidad científica para desarrollar nuevos materiales de investigación científica para el diagnóstico y el tratamiento oportuno de la salud en Cuba. Es interesante destacar que Cuba ha tenido éxito en los niños que están por nacer, bajando la tasa de mortalidad infantil de 4.7 por cada 1000 nacidos, y también tiene una gran importancia en el desarrollo farmacéutico, en nuevos descubrimientos y avances para el diagnóstico y el tratamiento, y sobre todo en enfermedades como el asma y dermatitis.
So moving on now to the maternal and child health care. Cuban ideology is to provide service to all in the country. The mortality rate was 4.0 for every 1,000 live births. In 1970 through from 1970 through 2010, the mortality rate decreased. In 2010, it was 40 for every 1,000 women, whereas in 1970, it had been 90 for every 1,000 women. There was the fall of the economy in 2007, which greatly affected maternal care, but the United Nations health goals towards 2030 put them back on track, put the whole world back on track as far as our needs to improve healthcare worldwide.
Sin duda la ideología socialista ayudó mucho para poder alcanzar las metas para el año 2030 del desarrollo sustentable para la comunidad cubana.
So, infectious diseases. There in 1962, there was established some vaccination days. The Center for Disease Control and Prevention also recommended hepatitis A and B, rabies and typhoid. Zika virus and dengue fever were also very prevalent at that time, and HIV and AIDS, of course, was a primary subject at the time.
Hay una impresionante reducción de las enfermedades infecciosas en Cuba debido a la atención principalmente de la madre y los niños, al aplicarles las 13 enfermedades que pueden ser prevenidas mediante la vacunación, y también controlando las enfermedades infecciosas más graves como es la hepatitis A y B, la rabia, la fiebre tifoidea, y sobre todo un gran éxito en la cuestión del tratamiento del VIH.
So the mortality rate, as recognized by the Pan American Health Organization and the World Health Organization, the infant decrease from 1970 of 38.7 per 1,000 to 4.3 per 1,000, which is an incredible decrease. They established a family doctor program, Casa de Maternidad, which was the maternity houses, which was a way for women that were in maternity could be cared for, especially cared for. And this meant that a lot of the women were outperforming the males in this situation. However, the abortion rate in Cuba is about 6 per 1,000 compared to the U.S., which is 8 per 1,000.
Es impresionante cómo ha habido una reducción en el rango de la mortalidad general, creando mayor expectativas de vida, sobre todo en América Latina y comparado con Estados Unidos, que es el primer mundo.
So the last topic we have studied for this was mental health in Cuba. Positive psychology, which was developed by Martin Seligman around the 1980s. He developed this positive psychology as a way to think of helping people mentally in a creative way, innovative way, to establish happiness and positive emotions.
Una de las cosas que hemos estado revisando con mucho detalle es la manera en que el aspecto mental de salud sigue siendo un problema no solamente para Cuba, sino para todo el mundo, y en este caso de una manera muy especial hemos visto que hay niveles de depresión, de suicidio, falta de esperanza, pesimismo y preocupaciones culturales que debido a la situación económica pues hacen un poquito difícil seguir adelante con muchos problemas. Sin embargo, con la psicología positiva de Martin Seligman, introducido en los 80, ha estado ayudando mucho a la población cubana, y el sistema ha generado más expectativas de creatividad, innovación y trayendo más emociones positivas a la felicidad cubana.
So to conclude, this has been a very interesting thing to study. Cuba's free medical attention with their limited resources. They're still a model for other countries. Maternal health care is one of the most effective around the world, especially in Latin America.
Finalmente hemos llegado a la conclusión, y para mencionar que uno de los logros más importantes del sistema de salud cubano es realmente que ha sido un modelo admirable para seguir para otros países, ya que pone prioridad a la medicina preventiva antes que a la medicina curativa. Gracias.
Gracias. Thank you.